Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
This month also marked the end of the COVID-19 public health emergency. There was a joint news conference with Baptist Health, CHI St. Joseph, and the University of Kentucky to mark its end. Let's see what the experts had to say.
Question from Karen Czar with WUKY. As you mentioned, COVID is not over. A report this morning showed the number of deaths in the past few months nationally would equate to, quote, a very bad flu season. How concerned are you that the ending of the declaration could cause numbers to again rise because of complacency?
Yeah, so I think the current numbers are hard to tabulate. We don't have a good handle on how much COVID there is out there when you look at the national statistics, because people are testing at home. They're not testing in public. I mean, there are some people that are still getting PCR tests in commercial labs, but the vast majority of the tests are being done at home, or people just aren't testing. I know from taking care of patients and my own, what I see going on around me, there's a lot more COVID out there than is being reported. Now, the other thing that I know is that most of the people in the hospital who have COVID are not dying from COVID. They're dying, if they die, from other problems. And the COVID has aggravated their heart failure or their underlying lung disease. It's not the same clinical situation as we saw in the past. So the Omicron variants seem to have an affinity more for the upper airway. They're way more contagious. People get the sneezing and runny nose and so forth, but we don't see nearly as much of the pneumonia with what we call the crazy paving pattern on X-ray with little splotchy areas everywhere, and then the patient's just crashing and needing to go on the ventilator. So it's a different clinical scenario than we saw in the past. Yes, we are having some people die with COVID, but most of it's not because of COVID directly.
For many people, both inside of healthcare and outside of healthcare, to kind of wipe their hands of it and think, okay, well, that's done. But we really are going to have to maintain some vigilance in watching the numbers. And if we see infections starting to go back up, there may be another pivot that has to happen. Hopefully, people will continue to get vaccinated so that the chance of that becomes low. But if we'll see it in the numbers if people are completely complacent about it.
We can monitor things now as what's going on in the hospitals. We're not going to have the public reporting anymore, but we can see directly who has it in the hospitals. Anyone that comes in with a fever in the hospital or any respiratory symptoms is getting tested for COVID. So that's how we'll keep a handle on it, and then we'll see what our numbers are and how many people are getting directly ill from COVID. I think most epidemiologists think that we will see a surge this summer. We don't know how bad it's going to be, but that's what's happened the last, several years. So I think it wouldn't at all be surprising if the numbers go up. Again, we have Arcturus, which is the most contagious variant ever. So we are going to have more infections, but I think we'll be able to handle and deal with it.
I also think it's important to remember that COVID is not the only virus out there. And honestly, other viruses could mutate, other viruses do mutate. And so I think the important message here is if we have a vaccine for something, get it. Vaccines save people. Go talk to the folks who lived 200 years ago and lost half their children, right? Vaccines changed that. Public health changed that. And if you're sick, wear a mask. I don't care what you got. I don't want your GI bug. I don't want your flu. I don't want your COVID, right? And you don't want to spread that. And as I always tell folks, you never know who in your life is immune suppressed. You never know who you're standing next to, who you could make sick. And all you have to do is put on a mask. It's not that horrible. So if you have symptoms, get tested, but regardless, put on a mask and stay away from large groups of folks for a few days, and we can all be better stewards of all of our friends. So I think that's the message.
We have seen an increasing number of other viruses, as as you just mentioned, and some of those viruses are parainfluenza virus 3, rhinovirus, metapneumovirus. and there's a whole plethora of them. The other thing that's been a little striking since December is we've seen a huge surge in group A strep infections. And it's hard to know exactly why that is. Group A strep infections tend to, commingle with viral infections. So if you have viral infection, you may be more likely to get strep. It may be that a new strain is circulating that's more virulent than previous strains. But we've seen here at Baptist Lexington that our numbers of invasive strep infections, and I'm talking about bloodstream infections, infections that close the throat off and shut the airway down, infections that are racing up in the muscles of the leg requiring an amputation, those have gone up fourfold compared to the previous 5 years.
Thanks to those experts who helped us navigate the COVID-19 pandemic. It's still out there, so still be vigilant. Make sure your vaccines are up to date. We'll be right back.